Good evening, everyone, and welcome to the Ocean Hill Brownsville Equity Coalition's virtual town hall meeting. We are super excited to present our topic that will focus on how we as a community can transform trauma into community care. This town hall will address how systematic racism has played a part in our overall health, and how this evening we'll be able to provide a framework for what we envision for the health equity to be within our community. My name is Anita Pierce, and I'm the principal owner of 11375. I am also a member of the Ocean Hill Brownsville Equity Coalition. We are a group of collective community-led organizations that is seeking to dismantle all of the anti-Black racist policies and practices that have perpetuated cycles of trauma within our community. The coalition, which boasts over 30 homegrown organizations and its members, we advocate and aim to improve the equality for the life and families of residents that live within Ocean Hill, Brownsville. We are ultimately ensuring that Ocean Hill Brownsville residents are heard, seen, and are able to thrive. I have the distinct honor this evening to welcome members of the community, our participants, and also those who will be providing us information to enrich us within this conversation. In order of program appearance, I will introduce our coalition members. And the first member that I will introduce is Mr. Franklin Mena of University. He will lead us in a wonderful meditation. I will also introduce Mr. Keston Jones, the Executive Director of the Farm, and Keston will introduce our moderators for this evening. Our program will wrap up with our Community Board 16 chairperson, Ms. Janice Morgan. And before we actually start our program, we want to thank you in advance for joining us this evening. And we are glad to present to you members of the Ocean Hill Brownsville Equity Coalition. But before we bring the coalition members to the table, I would love to welcome you with a video opener that will provide a historical perspective of our health gaps. And this was created by YFW Productions with a voiceover from one of our very own coalition members, Miss Renee Muir of BMS. So Latia, I will pass it over to you.
Shot here at 418 Lake Avenue in the Brownsville section of Brooklyn.
One teenager fatally gunned down, 2 others injured, and from all the shots.
Brownsville's crazy like that.
News reporter Derek Moore is live in the Brownsville section.
Live on the scene this morning in Brownsville with the
history of mental illness and a prior arrest.
This young man did not have to die.
Us as residents of the neighborhood all know the issues of Brownsville, Brooklyn. But the question is, was it always like that? Was it always like that?
Early 1800s, Ocean Hill grew into a thriving middle-class Black community founded by freed slaves. By the 1850s, Weeksville was the second largest free Black community in the country. Its school, Colored School Number 2, was the first school in the country to integrate both students and staff. Its baseball team beat the Colored Union Club of Hoboken in 1860. In the first known Black teams game. Its newspaper, the Freedom Torchlight, was one of the first African-American newspapers in the country. In 1861, Charles Brown bought neighboring parcels of land he developed into Brown's Village. By 1887, Brownsville began target marketing to overcrowded Jewish immigrants from the Lower East Side. Between 1899 and 1904, the population of Brownsville increased from 10 to 60,000.
New Lots was the station stop. New house lots on what had been farmland a few years before. The last stop on the subway, the place with the cheapest rents. Brownsville was a step on the ladder of upward mobility.
The 1950s saw a massive population shift as the Brownsville housing transformed. Over 4 million migrants from the Jim Crow era South, many from South Carolina, landed in Brownsville. Other African Americans and Hispanics displaced from elsewhere in the city, casualties of Robert Moses' urban renewal plan.
Brownsville is the most congested area with projects in the city, probably in the country, is Brownsville. This little 1.8-mile area has more housing complexes than any place in the country. And that's what kills the neighborhood. So across the street, right here in the Van Dyke houses, these were built in '53. So you see the Brownsville houses to your left, there's 6 stories. To your right, the Van Dyke is 17 stories. So people from the first floor to the 3rd floor to the 15th floor never met each other. They don't know where the world each other is. They don't know. That's a big difference. You know, but in the 6th floor, you can walk up, you meet people all the time, you see things going on in all the same general area in South Carolina. And they invited each other up, and they helped each other get jobs, and they helped each other get apartments, and they all found apartments in Brownsville. So that's what made the area such a family cluster. But when they built the projects, that took away from all of that.
When I was growing up, I was taught in American history books that Africa had no history, and neither did I.
The 1970 Brownsville trash riots. City services disappeared with the Exodus, and the area saw rapid economic declines, including the loss of commercial strips, increased high crime rates, and riots resulting from the city abandoning basic services.
Brownsville did not become impoverished and largely African American by chance or by white flight. It was a result of mindful orchestration during the Robert Moses era to displace large groups of African Americans into the newly built housing projects, really designed as a ghetto.
You know, there's a saying that if America catches a cold, Black and brown communities to catch pneumonia. And so COVID, I think, just exposed in a raw way the disparities that continue to exist in terms of access to health, the quality of health, and systemic racism in the healthcare delivery system.
It's always the way that we approached care. Social health, emotional health, spiritual health, intellectual health, environmental health. All of those imbalances manifest in disease conditions, from asthma, diabetes. If you don't have information about how to eat healthy and information about where to go, or you don't have the resources to get healthy food. And now, Franklin Mena, I'll turn it over to you.
Greetings, everyone. Good evening. What a powerful video. Thank you for those that created the video. Thank you for having me. My name is Franklin Alejandro Mena. I am the co-founder and executive director at University NYC, which is an aquaponic farm and a food hub. I'd like to thank those who have been able to honor me and be able to have me here. Thank our ancestors for having us here. Thank you for those that put this together. And I know today's probably been a day for everyone, and I'm glad that everyone is here with us. So before we get started, I want to thank our ancestors for having us, and take a quick deep breath so we can let go of the day. We can do ourselves a favor and just shake off the day, guys. We can just shake off the day. We're going to go to deep breathing exercise. Quickly, deep in through your nose, out through your mouth. Breathe in the flowers. Blow out the candles. 2 more breaths. Breathe in the flowers. Blow out the candles. And on this last breath, I want everybody to breathe in for 4 seconds, hold your breath for 4 seconds, and release for 8 seconds. And this is a practice that you can do for any time you feel stressed, or any time you feel anxiety, or any time you are going into a meeting and want to be present as best as possible. So breathe in for 4 seconds, hold for 4 seconds, and out for 8. Thank you, everyone. Thank you again for having me. For setting the attention for this meeting, I would like to address that we will do our best to make sure that everyone gets their time and their attention. I look forward to everybody's words. Peace and blessing. Thank you.
Wow, that was great. Thank you, Franklin, for really setting the tone, especially after we saw such a weighty video. Many of us on this panel are very familiar with Brownsville. I myself, as someone who works and lives in the area, I see many of the things I would address in the video, and oftentimes we see the problems, but I certainly want to talk about the solution, and I want to find answers and find out ways how we can be of support to this community. That for those of us that are from this community know that if we were provided with resources, we would certainly thrive. And there are resources here, and this is the opportunity for us to bring these resources together. So without further ado, I will introduce our moderators for this week, this event. And I have the distinct honor and privilege of introducing Dion Grayman and Miss Erasma Veras Montetrolo. So I'll start with Dion. Dion Grayman is a second-generation Brownsvillian. Her grandparents were organizers in the historic Ocean Hill Brownsville movement to decentralize the Board of Education and change it from, I guess, an environment where the people weren't represented. As an educator, Dion has worked with a range of young people from youth impacted by the system on Rikers Island to students who attend specialized high schools in New York City. In her role as a staff developer for the Morningside Center for Teaching Social Responsibility, she provides training and coaching around the implementation of restorative practices to reimagine schools as centers of belonging and joy designed to support and honor the full humanity of Black students and other students of color. Dion's consulting business specializes in facilitating anti-Black racism, racial justice, and equity training utilizing a healing-centered framework. As a co-founder of We Run Brownsville, which began in 2015 as a grassroots effort to improve the health outcomes for Black and brown women who live and work in the neighborhood, she, alongside lifelong friend Sheila Barksdale-Gordon, have designed a health platform that includes physical exercise, social and emotional support, wealth literacy, and leadership training. Dion is a holder of a dual BA in English and journalism and a master's in special education. And 2019 BME Vanguard Fellowship for Social Determinants of Health. She is most proud of being the mother of Sean, Silas, and Sonia, and auntie to her 4 nephews, the Bell Boys. So let's get a round of applause. Snap it up. Dion. So now we'll move to Erasma Monticholo. Erasma is an activist, co-founder, and executive director of Power Up 2, a home visiting organization that nurtures the inherent potential in every child and family, equipping them with the tools to transform their own lives and strengthen their communities. Erasma holds a BA in psychology and criminal justice from St. John's University and an MPA from NYU Robert Wagner Graduate School of Public Policy. Before joining Power Up 2, Erasma work has taken her to remote places of Guatemala, where she partnered with indigenous communities to establish independent, sustainable businesses that improve their living conditions and stimulated their local economies. Erasma also has local government experience in her hometown of New York City, where she successfully established relationships with community-based organizations and social change groups to create partnerships and build support for a variety of programs serving vulnerable populations. Erasma is a big believer in healing-informed practice and approaches all of her work with this framework in mind. Erasma also serves on the board for the New York 0 to 3 Network and the Citizens Committee for Children of New York City. She's also a 2019 Promising Ventures Fellow and a 2020 Aspen Institute Healthy Communities Fellow as well. And without further ado, I would like to bring on the 2 panelists to take you through this process, a process of healing, a process of education, and a process of our further commitment to our community. Thank you. Take it away, guys.
Thank you, Keston, so much for the kind introduction. I too am a big fan of yours and the work that you do, as well as what your organization does at Farm. So thank you for all the work that you do to support Ocean Hill Brownsville. Having grown up in Brownsville, the video showcase this evening was challenging to watch, as I could very easily see the many factors that have influenced the health and well-being of my community. It is really clear that the factors are interconnected and can either promote or hamper our ability to thrive. In our case in Brownsville, for example, and in many communities of color throughout the United States, these factors have resulted in historical marginalization and trauma, and further compounded the impact of COVID on our community. The interplay of these dynamics are the focal point of the Black Lives Matter movement and will serve as a guide for our dialogue today. The 7 factors that we will touch upon today include, the first one is historical legacy, how our country's legacy of brutal displacement and genocide of Indigenous people and the enslavement of African ancestors undergirds today's systemic racism and anti-Black policies. The second is system leadership, policymakers that are often complicit in supporting the racist systems by creating policies that unwittingly harm already vulnerable communities. The third factor is power, a tool of privilege that only a few people experience. Those that have the access and resources tend to set the direction for communities instead of the community itself directing the strategy based on our specific needs. This, of course, strips our communities of its power and often leads to the creation of subcultures in which individuals aim to gain power and assert themselves. The fourth and fifth factor are related, and they're healing of self and social relationships. The negative effects of historical trauma on individuals and families is passed down intergenerationally. And to break free from it, we must engage in taking care of the self. Yet this is very difficult to do when you lack access to services focused on healing. And you can't have healthy relationships unless you learn to love yourself and reclaim your power. The sixth factor is community. We are made to think that our communities don't have the solutions and must rely on outside experts to guide us. The seventh and final factor we will talk about today is called hope. Prolonged exposure to toxic stress can breed a sense of hopelessness in communities. People can sometimes act out of sheer hopelessness, engaging in self-destructive behavior or other activities that harm others. And these are images and the narratives that get replayed on television or on the headlines of the local national papers time and again. So today we will pose questions that touch upon each of these factors and invite our guests to share their perspectives their learnings, both personal and professional, as well as join us in envisioning what a healthier, more hopeful Brownsville can look like. With that, I will turn it over to my colleague, my friend, and fellow Brownsville warrior, Dion Grayman, to introduce our distinguished guests and get us started with our first question of the evening. Dion.
Thank you, Erasma. And yes, good evening. Happy Monday, y'all. We just, next week, y'all already know what we got to do. I'm going to do, so our esteemed guests sent along their lengthy bios, and I'm going to try to not make them church long. So if there's something that I missed, then asking for forgiveness in advance. And if you'd like to have the full bio of our speakers presented to you, then that can also happen. So I'm going to start with fellow Brownsvillian, Tilden native, Dr. Thomas LaVeist, who is a leading researcher on the topic of health disparities and the social determinants of health, and the utilization of health services in the United States. He currently serves as Dean at the Tulane School of Public Health and Tropical Medicine down there in Louisiana. Prior to this role, Dr. LaVeist was the he was at the Milken Institute of Public Health at George Washington University, where he was the chair of the Department of Health Policy and Management. He also spent 25 years at the Johns Hopkins School of Public Health, where he was the William C. and Nancy F. Richards Professor in Health Policy and the director of the Hopkins Center for Health Disparity Solutions. In addition to his role as Dean, he's also the Weatherhead Presidential Chair in Health Equity. Welcome and thank you. Also joining us is my clay cousin, Dr. Torian Easterling, who serves as the first Deputy Commissioner and Chief Equity Officer at the New York City Department of Health and Mental Hygiene, a role that was created specifically for him. Dr. Easterling has spent more than 5 years in a senior leadership role at the Health Department prior to serving as the first Deputy Commissioner and Chief Equity Officer. I love the way that sounds. He also served as Deputy Commissioner at the Center for Health Equity and Community Wellness at the New York City Department of Health and Mental Hygiene, where he oversaw programmatic work focused on reducing overall premature mortality and closing the racial gap on the top leading causes of preventable death. He also served as the Assistant Commissioner of the Department of Health's Bureau of Brooklyn Neighborhood Health, where he helped advance key programming to address pressing issues. Welcome. Pressing concerns, including maternal death and gun violence. Dr. Easterling is a community physician committed to health equity, social justice, and movement building to achieve the health outcomes that all people deserve, both locally and globally. Also joining us is Kassandra Frederique, who is the Executive Director of the Drug Policy Alliance, a national nonprofit that works to end the war on drugs, which has disproportionately harmed Black, Latinx, Indigenous, immigrant, and LGBTQ communities. She builds alternatives grounded in science, because we have all come to realize how important science is, compassion, health, and human rights. Throughout her work, Frederique has been a powerful advocate for working closely with people who have been directly impacted by the war on drugs, and she has built strong alliances with partners in New York and beyond to support her in that work. We also have Dr. Shirley Smith, whose practice is dedicated to helping clients improve their lives through personal growth. She is a clinical psychologist and a licensed clinical social worker here in New York City. And she's been in private practice specializing in multicultural counseling for more than 30 years, working with both individuals and groups. Her practice fundamentally includes the concern and awareness of clients' racial or ethnic identities, country of origin, physical ability, sexual and gender preference, and spiritual and religious affiliation, all the things that make us who we are. And finally,
one of our own, Councilwoman Alicka Samuel, has always been a visionary dreamer and a fervent believer in the better angels of our nature. Behind her signature glasses and smile rests her grit and empathy that have both been forged from her upbringing here in the land of never ran, never will. She's carried this with her throughout her experiences, which have guided her to North Carolina A&T State University, shout out to HBCUs, culminating with a psychology degree, and subsequently on an almost yearly basis, a return to the greatest homecoming on earth. She went on to earn a Juris Doctorate degree from CUNY School of Law and has continued to model the school's motto, law in the service of human need. Alicka has worked in various capacities with city and state legislators and has spent years sharpening her servant leadership and perspective concerning marginalized individuals and their plights, both locally and internationally. Those are our panelists for this evening. And to get us started, I have a question that is for everyone before we go into more specific questions. And when we think about equity, specifically health equity, that can mean different things to different people. What does health equity look like to you? And so we'll invite everyone to participate in this part of our conversation. But Dr. LaVeist, I think I'd like to start with you. What does health equity mean to you?
Well, thank you for that question, and thank you for the invitation to participate in this important conversation. I would say equity, health equity means that every individual has an opportunity to have the optimal health and well-being. That the level of your health is not a function of inequitable practices within society or an inequitable distribution of resources, but rather it's a result of your own decision-making to the extent that you are able to make those decisions and act on those decisions. So that, in other words, that the factors that impact your health is based on what you do, what you decide to do, and assuming that you have the education and the knowledge of how best to take care of your own health, and not determined by external forces such as healthcare systems or policymakers.
Thank you. Dr. Easterling, can you share with us your definition of health equity?
Sure. I think the definition itself doesn't change much from what Dr. LaVeist just mentioned, but I certainly would just sort of expound on that just to say that to get there, I think part of what I understand is that part of a health equity lens has to be rooted in the anti-racist framework, and it has to be rooted in voices who have been traditionally not a part of the decision-making process. If we're going to get to a place where those factors that Dr. LaVeist just mentioned, those external factors, do not play a part, and that folks can really determine, their health, that they have, that the choice to be healthy is the easiest choice, and that's not the state that we live in now. So, I think that's sort of the trajectory. That's what we want to push.
Thank you. And Dr. Smith, is there anything that you can add to that? Dr. Smith, you're on mute.
Okay, am I all right now?
Yes.
All right, I pretty much, I agree with Dr. Easterling and Dr. LaVeist. Am I saying your name, LaVeist? What I want to stress is that you can't have good health without having good mental health. You need them both because one affects the other. And if you have good mental health and you have good physical health, you're able to deal with these crises that we're going through right now much better. And with the racism we have to deal with on a daily basis. That's all.
Thank you. I almost want to say Dr. Frederique to keep it even, but
Kassandra, what can you offer?
I can offer us time because I don't think I can say anything that the panelists haven't said.
Okay, I appreciate you. And Councilwoman, is there anything that you'd like to add?
I would just throw out there just the words that come to my head when you mention health equity. For me, the words that come out, that jump out, is just access and options, and not just looking at the, going to the doctor aspect of it, but just a total healthy lifestyle. And for me, that's, open space and, green space and access to food, like what we put in our body, just the whole person. And so for me, that's just, just looking at what we complain about and lack, and, trying to just flip that around. So access and options, and what does health really mean? And that's just everything.
Thank you. Yeah, I think the key to access, like and options, were brought to stark relief with the presence with the presence of the two pandemics, and I'm borrowing Reverend William Barber's language of COVID-19 and COVID-16-19. And so where we saw the disparities more starkly in people not having access in our community. So I want to go back to you, Dr. LaVeist, and just as a person who grew up in Tilden and grew up in Brownsville, and an author of The Skin You're In, can you talk to us about poverty? We've heard the term deep poverty or concentrated poverty, and can you talk about how poverty relates to access or the inability to access care and preventative care?
I'll try to answer that quickly because I know we don't have a lot of time, but that's a long question. Poverty affects health on so many different levels. I mean, first is just the lack of having resources to be able to pay for healthcare, right? So in this country, and we are the only country that does this, we tie access to healthcare to employment rather than to citizenship. So as a result, if you have less economic resources, you're less able to access quality healthcare. I ask my students all the time, do we have the best healthcare system in the United States? And of course, it's a trick question, because the answer is yes or no, depending upon who you are and which healthcare system you get to access. We don't have a system, we have many different systems. So poverty dictates who gets into which of those systems. But poverty also impacts individuals' decision-making, because if you are limited in your ability if there's no Whole Foods in your community, I don't mean by Whole Foods grocery store, but I mean good quality food where you live and can eat, then you don't have an option to eat a good quality diet because you don't have access to one. So, and poverty does that. Poverty also affects you psychologically, right? Because if you are told that you are impoverished, and you are impoverished because you deserve to be impoverished, because there's something deficient about you, then over time, you will begin to incorporate those belief systems. And this is the way that internalized racism impacts us. So there are many different levels. I'll stop there and let others comment on some of the others, but those are three ways that come to mind immediately.
And immediately you went right into that idea of just pull yourself up by your bootstraps. And then if you don't, then there's something wrong with you. But it's like, yeah, but I don't even have the boots, right? Like that doesn't even work.
Even if you have the boots, if you don't believe that you can pull up those bootstraps, which is what poverty also does to you, this also will be a barrier.
Would be a barrier, yes. Thank you for that. And Torian, can you walk us through, which touches on just what Dr. LaVeist said, can you walk us through the social determinants of health and the impact that COVID-19 specifically had on them, because you got called back to work because of COVID, I know, because you were out on paternity leave.
Certainly. So the framing of social determinants of health is relatively new, within the public health jargon. But when we think about sort of the innovations of public health and really making sure that individuals have quote unquote good health. So how we frame this, sort of there's these spectrums. Traditional public health sort of talks about, sort of mortality and morbidity, and so how well you're able to maintain, your health. And we talk about, sort of the, washing your hands and making sure you have access to healthcare. But then, over time, emerging science really sort of to talk about, sort of the environmental factors, those external factors, and social determinants of health. One can sort of sit in this sort of lane where we talk about the living condition. So we know that someone's housing, someone's education, someone's job has an impact on their overall health. But you can even move a little bit further up and start to talk about the institutional factors. And so we know that what's in those institutions that are in neighborhoods can also have an impact, whether or not hospitals are discriminating or experiencing any bias or how they allocate resources. Those institutions play a part in an individual's health. And so, you have even higher than that, you sort of think about the social. So I think about those spectrum, sort of the social inequities, the institutional inequities, as well as living conditions, all fall under sort of the nomenclature of social determinants of health. And so, where we are right now with COVID-19, we're seeing an increase in cases, and we certainly have to be vigilant. I mean, the citywide rate here in New York City has been the highest it's been since, as we were coming out of wave one. So that's, particularly that's around May and June. And so we certainly have to be vigilant. In Ocean Hill, Brownsville, the citywide positivity rate is much lower than the city. And really, we look at the percent positivity because we're looking at transmission. We didn't have this at our disposal in March. We weren't testing. We didn't have the infrastructure. And so now we're able to look at the data and sort of see, what's the rate of transmission within the community, how many people are getting tested, and what additional resources are needed. But you're also talking about sort of the structural issues, because absolutely there were inequities, and those inequities weren't rooted in testing infrastructure. It was really rooted in the fact that those institutional inequities, those social inequities that we knew already existed became amplified. And so, certainly, we're needing to really begin to push and make sure that the institutions, the infrastructure within our community are better prepared, better set up to serve our people. And I think that has to be a part of emergency planning, emergency preparedness. And we cannot wait until the crisis is already here.
Thank you. Erasma.
Yes, thank you, Dion. So I will direct a question to Dr. Smith, if I may. So Dr. Smith, you are a clinical psychologist and a licensed clinical social worker in New York City. As someone who has been in private practice, specializing in multicultural counseling for more than 30 years, working both with individuals as well as groups, I'm hoping that you can help those that are listening and those that are watching understand what is trauma and how does it present in communities like ours in Brownsville?
Okay. When you think of trauma, you should think of stress. And African Americans, just talking about African Americans, we live a stressful life. It can be day-to-day stressful life, the skin color is stressful when people have pre-thoughts about us, okay? So when you think of racial trauma shows up in the physical and psychological system, like hyperventilation, headaches, insomnia, body aches, memory difficulty, self-blame. We do a lot of self-blame, confusion, guilt, and it's accumulation of suffering. There's a lot of suffering with Black Americans because of this. And then here comes COVID, which really complicates their existence, our existence. before many people were almost making it, then all of a sudden COVID comes and you're stuck. You're limited. You're unable to focus. You're unable to do anything. You feel powerless. Bad enough you did feel powerless before, but you feel more powerless.
So if I may, talking, you talked about the accumulation of all of that, right? The accumulation of toxic stress, the accumulation of past trauma, and that being amplified because of COVID. How are you seeing its manifestation? Has it changed as a result of COVID? Has it amplified? How are you seeing that manifest, for example, in adults versus children?
Well, as far as children, now as far as adults, their stress level, of course, has increased considerably. I get a lot of calls, and it's all about stress and anxiety. People are stressful. They don't know what to do. They don't know where to go. There's a lot of hunger out there. There's a lot of homelessness, and we as Black people see other people going through that, and we just anticipate that that's going to happen to us. I'm going to be next. And I get a lot of calls for that. In fact, I have started groups on just that subject: COVID, how to cope with COVID. How to cope, and what I'm doing is getting people to focus on the here and now, just to focus on what they can do for themselves and their families, and stop worrying about outside, which is hard because if you're doing all the things you're supposed to do, like wearing the mask and wearing gloves and washing your hands, and then you come across other people who are not doing the same, and they're trying to talk to you. Many of my clients talk about how stressed they are. They live a very stressful life. We all do. COVID, and also they're so powerless because nobody knows what's going to happen in the future.
Yeah, I'm wondering if you could also just give us a sense of, I know what you're doing specifically to address, the impact of COVID, but what would be a suggestion that you would have, for us, right, as a collective, that you think?
Well, yeah. All I could say is that, like I said, I found that people can help each other. So I started these groups. And groups are so very good for Black people because we are known to hide our fears and our doubts. We're always embarrassed. Black people are brought up on shame. They got to get that shame out of their mouths. No more shame, And so people are really scared. But once they come together and they're as a group and they start working together to manage their stress. And that's what I tell them. We're going to manage your stress. You're going to manage your stress. I try to empower them. What can you do on a daily basis to manage your stress? They even have simple, because you got to give them homework. They have simple things like a checklist. And I said, okay, on that checklist, it could be just one thing that's stressful. You can put other things like wash the dishes, whatever, cook a meal. But, like one woman, she was very scared of leaving her home. And I said, you can leave your home to go to the market, but you can't go and do laundry the same day. It's just overwhelming, Also, I give them breathing exercises, which are very helpful. And I insist that they go out and they walk among the trees. If you walk among the trees in any park, and if you do these breathing exercises, one that we did at the beginning, and then at the beginning of this event, and others, like I have 3 in and 6 out, slowly. If you do that, there's this chemical that comes off the trees, and it will just reduce the stress level, reduce your anxiety and your depression. It's amazing. And then people are able to focus and make better decisions. And I think that's my objective in this group, helping people see that they have power within, and they can make better decisions if they just stop getting so involved with what's going on that they have no control over. You know, concentrate on what you have and concentrate on day to day, because you can't make plans for a month from now or 6 months from now. So if you concentrate, and you do more than survive. In fact, you'll learn to be more resilient, and you'll have less stress and fear and doubt.
No, that's really powerful. Taking care of the self first, making sure that you're connected and grounded to nature, making sure you're connected to the social groups that are going to support your healing. I think that's tremendous. Thank you. Thank you so much for sharing that. And that, I think that creates a nice segue for Councilwoman Ampry Samuel. So Councilwoman Ampry Samuel, as someone that has grown up in Brownsville, and you're currently representing District 41, which includes Bedford-Stuyvesant, Ocean Hill, Brownsville, East Flatbush, and Crown Heights, I know that you're incredibly committed, and I know that as part of your campaign a couple of years ago, you ran on the idea of the hope within. And since you were elected to your seat on the City Council, you have served on 7 committees: health, education, finance, mental health, disabilities and addictions, committee on public housing, committee on veterans, committee on criminal justice. And so I'm curious to hear, what do you consider to be the common thread among all of these committees?
Let me first say that you said I ran on, right? I want people to understand when they look at elected officials across the country, I'm not a member at large member of the New York City Council, right? I represent my community. I represent my home. And I know in other elected bodies, you have members, member at large, which means that you just run and you don't necessarily have to live or have any kind of connection to the community that you represent. So I just wanted to have people understand that, and I'm not a transplant. So I just wanted to say that too. So yeah, I ran because I'm from Brownsville and I'm 4 generations Brownsville, right? And so, so everything that I am, like the committees that I serve on, is intentional. Like I had to ask the speaker to pick me and place me on these committees. And I'm placed on those committees because there's a need for me to be on criminal justice. There's a need for me to be on the education committee. There's a need for me to be on the health committee. I'm on the health committee and I'm on the mental health, addictions, and disabilities committee because of what's going on in my district, because of my home, right? I chaired the public housing committee because I grew up in public housing. Like I grew up in Marcus Garvey houses in Brownsville, right? So the thread for me between all the committees is the fact that my district is intimately involved in each of those committees. And I have to be there. I have to be at the table. I have to be at the committee hearings and meetings to get the information that's needed, and also to be able to articulate and advocate on behalf of the people that I represent. Because if you're not there, if you're not part of the committee, then you're not privy to a lot of information and resources that come to the table when we're talking about budget time and everything else. So the thread is just pretty much the fact that everything that we go through in the 41st Council District is related to the committees that, I have been assigned to intentionally.
That's great. Thank you for that. We have heard from many residents that they are disheartened by local government's response during the onslaught of the pandemic. Many have questioned, how electeds have prioritized certain issues to the detriment of others. And so what do you consider to be the prevailing philosophy in city government today as it relates to prioritizing issues and policies, acting in response to, the will of the people versus acting in the way the city officials believe is the best course of action. So in answering the first question, you mentioned that you intentionally selected, those particular committees because you knew that there's a need. You know that there's a need in the communities that you're representing. So can you speak to that? Can you speak to, the decision making and how elected officials are prioritizing certain issues versus others?
So the first big issue and big hurdle when you go to City Hall and just show up representing your people in your district is the fact that you got to deal with racism, the fact that you got to deal with a bunch of white men, the fact that the mayor is white, the speaker is a white man, our controller is a white man, right? And the fact that we have 51 members of the New York City Council and only 12 of us are women, right? And so even though this is New York City operates and has the appearance is a hick town in the South. Just, let me put that out there. And so when I'm showing up to a budget hearing or even a committee hearing, I'm a Black woman that represent Brownsville. And I am talking to, white men who represent Bensonhurst or the, Upper West Side or, other areas where, again, this is New York City. And even though the majority of us are Democrats or democratically elected, that does not mean that the priorities are the same. And so when I am trying to, bring resources back to my community, or when I am trying to fight for certain budgetary items for certain agencies that would have a direct positive impact on my district, I am competing with white men who don't give a damn about Black people in Brownsville. And so if we don't have enough people elected to office that look like us with the same experiences, then we will not get what we need in our communities. The fight is real. Being marginalized, even in New York City, that's real. And so it's very difficult. And I mean, I appreciate the fact that I have folks like Dr. Easterling that I can call in agencies, and he's in leadership, and we can have a conversation. On a Sunday night at 10 o'clock at night while the baby's crying. I'm apologizing like crazy for the phone call, but that's because we have to have people in positions of leadership in these agencies, because the folks that are actually at the top and running things their priorities are very different.
Dion, I know that we both want to get to Dr. Frederique. I just have one more question for Council Member Ampry Samuel, if I may, and that is, based on what you've seen that has happened over the last 7 months in the district, what do you envision doing differently this time, right? When we're thinking about recovery for New York City, when we're thinking about recovery, what does recovery look like for us in, particular in Ocean Hill, Brownsville? What do you think you're going to do differently this time, after the 2020, what is it? I always get those mixed up, but, in hindsight is 2020, right? So the ability to learn from the choices and the decisions that were made, not only personally, but professionally, right? What do you think you may do differently when you're thinking about, what recovery looks like for our community? And then in preparing for potential, another wave or potential other emergency that we may be faced with?
More intentional organizing, more intentional meetings with the people, like what we're doing tonight, right? Having these thoughtful roundtable discussions and having a plan, and making sure that we are strategic in what we're doing and how we're doing that. And for me, understanding that when I went to City Hall and showing up, like it's important to show up, because we have leaders that don't show up, right? But showing up is not necessarily enough, because my voice is as strong as the voices of the people that I represent. And so being able to make sure that the community members understand that and hoping that we can learn from the level of aggression and people just being sick and tired of being sick and tired, and the protests that sparked because of what everybody was going through with the two different pandemics, and being able to capitalize on that feeling with the people and saying that they didn't care, and you see what happened to us, and it's now or never. And for me, being intentional in organizing, making sure that people continue to feel inspired and want to be a part of civic engagement, because that's a real piece of it. That organizing piece is real. And I just want to say real quick too, when I was just listening to Jocko's voice in the video at the beginning, over 10 years ago, me and Jock sat in some apartments in Brownsville houses, and we came up with the concept of hope is inside. We said, what can we do to give people hope so that they can start to feel like we don't need anybody from the outside? Everything that we need is right here in Brownsville. And me and Jocko stood there and said, you know what, let's just tell people hope is inside, hope is inside. So we left out of that apartment and went to a printing shop and printed up a bunch of yellow cards that said hope is inside. That's all it said. The card was yellow, hope is inside was in white. And we printed up like 10,000 of those and just started throwing those around Brownsville. And that's how people started saying hope is inside. Then we started to get t-shirts and hats and, doing murals and everything else. But it was about trying to change the mindset of people. And so, running for office and getting political, getting into the politics part of it is always challenging, because even though I walk into City Hall, I'm Brownsville all day. And I come there with Brownsville on my back and my shoulders, and it suffocates me from time to time, because everything that everybody go through is in me 4 generations, and then start to raise a teenage son here. And so I have that, plus the fact that, I have to actually be a leader during this time. And so for me, the focus is really on making sure that the people are engaged, they understand how they connect to the national stage, and, just encouraging people to show up and show out.
Thank you. Thanks so much. Dion, I'll turn it over to you.
Yeah, thank you. I think that that the hope is inside, right? We know that that's not true for everybody, right? And so that when we can generate hope through some of the practices that Dr. Smith said, or through gaining access to resources, including health services, then maybe we can feel hopeful. But for those who don't feel hopeful, for some of those who don't feel hopeful, there's Kassandra, I'm coming to you. So if I'm wrong, then please let me know. But there are some people who hope comes in the form of a chemical substance. Though I look very young, I remember Brownsville in the 80s, right? And then I remember, I can't count how many friends I lost to gun violence. And then when I was a teacher on Rikers Island in the early 90s, I saw what the war on drugs looked like for real, for real. So can you walk us through, the language, right, which had some very devastating policy, right, attached to it, the war on drugs, and its effect on communities of color, writ large, but specifically on Brownsville, and then the city's response, the government's response, the city's response to supporting people during this time of COVID-19 who have been, who do have challenges with substance abuse. Did that make sense? Did I get that out?
Yeah, you did.
Okay.
So thank you for inviting me. I've been listening to so much of what the other panelists have said, and I think one of the things that I think is really important to start off is that everything we're talking about, especially when we're talking about health equity, we can't have a conversation about health equity if we're not having a conversation about criminalization. Criminalization is the praxis in which we're navigating. And part of that is because Black people have always been criminalized ever since we came here. And one of the other practices that we have to look at when we think about COVID-19 and the way that it has disproportionately targeted our community when we're thinking about deaths and infections is also because a lot of the people in New York were able to work from home. And it's the fact that our communities had to work and consistently were either unemployed, lost their jobs, or unemployed, lost their jobs, therefore lost their health care, or employed in these frontline services, which made it difficult for them to do the social distancing. And the ways that we live, where we live in congregate housing, not just if you're like homeless and living in shelters, but also because our families are bigger. I come from a Caribbean background. You know, we got one bedroom and there's like 6 of us in there, right? So it's like even just managing the space is different. And a lot of that is based on the strategic and intentional divestment in our communities. And, you know, I really appreciate Dr. Smith talking about breathing in and having those conversations. And as a social worker, I totally understand those interventions, but you can't breathe in if there's tear gas in the air, right? And you also, and part of the things, if we're looking at places like in the Bronx and in parts of Brooklyn, you can't breathe in if all the bus depots are there, and therefore all our kids have asthma, which is also a pre-existing condition to exacerbating the effects of COVID. So if we're talking about breathing, we got to talk about the air quality in which that we're navigating through every single day. You know what I'm saying? So it's like there's this larger context that we can't even have a conversation about health out in a vacuum, because our health is already in danger because we are Black people living in the U.S., in the Western Hemisphere. And so I think it's that structural divestment that's really important. Now, you asked me the question about how people find hope in drugs. And I want to be clear, because I understand why you're asking the question, because of people who find hope in drugs and then problematically use. But there's a large spectrum of people who use drugs. And most people who use drugs don't end up in problematic situations. And that's often really hard for people of color to hear, specifically Black people from New York City, from which I'm from, because we have a very particular experience. You know, we knew if you used that, then you were struggling. And by doing my work at Drug Policy Alliance, I realized that the spectrum is bigger, and that how we get from 0 to 100 when we're talking about addiction is because drug use is not happening in a vacuum. Drug use is happening within this context of criminalization and divestment. And so when we're having the conversation, everything about the drug war was intentional. Nothing that we are navigating is by coincidence. The drug laws were created because they were associated with communities of color, because they were associated with poor people, because it was associated with immigrants. The first drug laws in this country were passed for Chinese migrants who came to build a railroad in California. Does that sound familiar? So you know how the U.S. rocks. They bring you here either against your bondage, or they mess up your country, so then you're forced to come here. And then they exploit you for your labor, and then they criminalize you as a way to control you. And the most effective way that they've been able to do that is by using drugs. They did it with Chinese migrants. They did it with Mexicans in the Southwest. And they've also done it with the free Black people in the South. That's one of the ways that cocaine became prohibited, was because free Black people, free Black porters were using it to stay awake. And the massive media turned it into white women are in danger because these Black people are using this white powder. And so I often start there because I think we have to have the honest conversation about the role that drugs have played in our communities, and that how drugs could only do so much damage because the government had already divested in our communities. Like, they had already started taking things out. We were already dealing with deindustrialization. We were already dealing with high unemployment, and drugs came in and exacerbated an issue. And so much of our conversation about drugs is rooted in the trauma of what we've seen around drugs, right? And so much of that trauma is associated with the use as opposed to the policies. So I don't think it was a war on drugs, because a lot of the same people that are dying of cocaine overdose right now are the same people that were using cocaine in the 80s. These are older Black men who are dying of overdose associated with stimulants because they never stopped using, right? And they didn't die in the 80s, so they're dying now. And then we're having the conversation where we're in this moment where we're talking about health equity, where we're talking about structural violence, we're talking about social determinants of health. The conversation about drugs, it really isn't about drugs. This war was intentionally done to communities of color. And I'm not saying that drugs didn't make it worse, right? Like that the drugs had no neutral effect. That's not true. But what I will say is that we have to pay attention to the lens in which we're talking about drugs, because so much of it is focused on people as opposed to the policies that were put in place. And it's the policies around the drugs. If you look at the disparate treatment, if you look at the disparate enforcement, if you look at this current moment where we know that they could have done something different because we're in the middle of an overdose crisis, and those white boys in Staten Island, they was pulling out so much money. They were closing treatment facilities in Black neighborhoods to move the resources into white neighborhoods, right? That is structural genocide, right? And drugs have been used as a scapegoat to do that. And the thing is, Council Member Samuel, when you say, hope is inside, I think that's so important. And I also think that we have to have the conversation that so much of what we know is driven by the violence that we've seen and the trauma that we've seen. And sometimes it limits the way that we see each other. And it limits the solutions that we think are possible, because we are thinking and making policy based in the trauma. And we're in my therapist say, I'm so scared of getting hurt that I limit my options about how I can live. And oftentimes I think that that's how we look at drugs in our community. But also we have to be really clear about the way that they have used urban regional planning and design as a way to reinforce these stereotypes, and the disproportionate, the saturation and the disproportionate placing of services has also impeded our ability to be our better selves. And so in this conversation around Brooklyn and Brownsville in particular, the work that I've done is really focused on marijuana arrests, and the way that they use marijuana arrests not only to arrest people, but also take people's kids away, also to deport people, also to kick them out of their housing. When I look at the conversation about health and wellness, and I think about marijuana, I think about the fact that on the cover of magazines, you have white mothers in Park Slope talking about how cannabis helps their parenting in the pandemic because their kids are stressing them out. And knowing that on March 14th, when COVID was running rampant, I'm talking to public defenders who are saying in the middle of social distancing and everyone in the hospitals being scared, they're still taking Black women's kids away because they're drug testing them for cannabis without their consent. And so I think when we're having this conversation about the role of drugs, I think we can't talk about drugs without talking about the intentional policies and the ways that we've expanded carceral interventions as a way to deal with community wellness. And that has never been about equity, and it's definitely not about health. And it's all about creating the ways for us to otherize our family members. That's certainly been the case for my family. And I think that when we're having conversations about COVID, knowing that the overdose crisis is increasing in the middle of a health pandemic, knowing that, I live on the Upper West Side. So I was dealing with the white folks that were like, hold up, you can't put these people in our neighborhoods. And I was like, y'all weren't even here for 6 months. Y'all just came back. Y'all actually coming to Trader Joe's so you could do your groceries so you could go back to the Hamptons, right? Like, let's be honest, the way that we have treated our folks that look like us, that are struggling with mental health, that are struggling with substance use, that's based on the narrative that we were given about drugs. And I think it impedes our ability to show humanity and compassion for people that look like us. because so much of our response is driven by trauma and violence. And so we can't have a conversation about health equity if we're not having a conversation about that this stuff is not happening in a vacuum, and that we can never divorce health from criminalization, and we can't divorce health from inequality, because criminalization actually widens the gap of health disparities, it widens the gap of education disparities, and it also widens the economic disparities in our communities, all of which make us unhealthy.
Thank you for that. Thank you for increasing my understanding and for supporting the change in language that I'm going to have to make now. So thank you. I want to give our other panelists an opportunity to share what resonated or respond to what Kassandra just offered us.
Can I just jump in here real quick? So when I was saying that this is a time to have these real conversations with the community and be able to organize. It made me think about, since we're talking about Brownsville specifically, right? It made me think about PS 125, just as an example. And with that particular space across the street from BMS on Rockaway and Blake Avenue, there was a conversation about that being an inpatient substance abuse treatment program, right? And when that conversation first started, for me, everyone knows my father died of a heroin overdose, and I take this very personal, right? And I know the effects of long-term inpatient treatment, how it works. And this city has moved away from, providing funding and resources to 6 months, inpatient treatment, and more. We're going to have this methadone maintenance program. There are 10,000 slots available across the city. We're going to put more money there. And so the community was not at all supportive at all with PS 125 being an inpatient, like long-term treatment facility. Even though we have, all of these issues, like you just walk down the street to Mother Gaston and you can see the need for such. And, and it was also, I was hearing that, well, it won't be for us. If we have it there, you'll see people from outside of our community that would get beds there. And so, I think that this for me was just, very helpful in being able to, frame the conversation with the community about what do we really need, and I'm all for, having our folks go to maybe Denver, Colorado, or, someplace out west for treatment, but the reality, or even Miami, but the reality is, folks need to be home and close and be able to still, receive the treatment that they need on an inpatient.
What you're saying, Councilwoman, is exactly right. And I want to be really clear. People lie, and they lie to Black communities all the time. And they tell us that these services are for us, and we get those services come into our neighborhoods, and they're not for us. We can't afford them. It's already filled up, and we're just the space for it, right? I often go to these treatment facilities or syringe exchanges, and I ask them, I'm like, are you taking a stock of where your people are coming from? And oftentimes, it's rarely in the neighborhood that people are going. It's people, they're like some people, and it's often like a lot of white folks that are coming to these places. And I think we need to there's two conversations. Why aren't our community members using these services? What about these services what about them are not incentivized for our community members? But also, how do we make them less rooted in white talking points? And white talking points about racial equity, which are never about racial equity, right? They're just kind of like the window dressing. And so as someone who's Black that does drug policy reform and who identifies as a harm reductionist, I often find that I'm struggling in navigating the way that the white dominant culture sets up services and then potentially exploits and then extracts from Black communities. And then gets upset when community members ask the questions that they do. And then everyone says, oh, it's because they don't understand. And it's not that people don't understand, it's that we've seen the game before. And I find that sometimes people are not honest. And so one of the things that I think is really important is as communities have these conversations, that we push to have more Dr. Easterlings to be in the conversation, because every time the conversations happen, you find white addiction doctors, you find white public health people, and they come in with their talking points, and it's like, no, like, why should we trust you? Because let's be honest, the medical system is also a carceral system, right? Like, the medical system has done more. There's a lot of trauma in our community, like, navigating this. And so I want to affirm why people are suspicious. I want to, like, validate that realness, because parts of it is true, right? And I think oftentimes people focus on the miseducation and trying to educate you on, no, methadone is important, blah, 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 but nobody talks about the overdiagnosing. Nobody talks about the oversaturation. Nobody talks about the fact that, yes, a lot of white people use it, right? Nobody talks about the fact that Black people aren't offered office-based treatment like buprenorphine, right? No one talks about the highly restrictive nature of it and how they make you stand outside so everyone can see you, and white people are able to go into their doctor's offices and get a prescription. This is why I'm saying you can't have a conversation about health equity without the conversation about criminalization. Because it is the praxis in which we're navigating through, and people won't have that conversation, not fully. And I think that part of it is because what we're trying to do is different, and we don't have all the answers. But people still trying to give you all the PowerPoints and all this stuff to be like, we got all the answers, but we don't. And then the community goes with it, and the results are different than what everyone promised. So when we come back again, given the same talking points, and communities are, hold up. Everyone thinks it's Black people don't want people to get treatment. Black people don't care about the Black people that are homeless in their neighborhood. Black people don't care about people who use drugs. And that is not the case. It's that we're tired of being lied to. Tell us the whole truth and give us the opportunity to make these decisions. Because we watch how these white people get the information and decide that they're not going to have it, and then they stand down. And then for us, they just stuff it down our throats and act as if we're the problem. So I just want to say it's not an either or, it's a both, right? We have to have both conversations at the same time. So I just wanted to affirm you, because I know sometimes, especially Black electeds in New York, y'all get lambasted. And listen, I have thrown Molotov cocktails in my past at electeds, because sometimes y'all be wilding. But I do have to say that part of it is because the standards that you're under are not the standards that Brad Land is under, and not the standards that Stephen Levin's under. And they get to play a different game than you do. And then you get the progressive people being like, yeah, these white people in front of these Black issues. And then, we're upset because we're like, yo, why are you not standing with us? But part of it is the way the conversation is structured and the fact that people aren't telling the full truth.
So if y'all thought y'all wasn't going to get real talk, somebody told you wrong. Welcome to Brownsville, y'all, right? So Torian, Kassandra said it is important to have you in on the conversation. Why is it important that you be a part of a conversation about this?
Well, that was a lot. Let me just take a deep breath for every one of it, because I received all of that, and I was certainly thankful for just being not even in dialogue, just to listen to Kassandra. I think the point that I just want to lift up from something that was already mentioned is this is so important, a part of the health equity conversation of just having shared language and shared analysis, right? So when we are in dialogue, like, we can have this conversation about what's real and what's not, and what's our way forward. And I think that's a part of sitting in leadership, so that we can translate through all the garbage and all the mess that we constantly hear every day, right? And there is a lot of noise, and we really got to be able to sift through it, and we got to be able to tell our story. And something earlier I was saying about health equity and the ability to make sure that we have the voices. It's this reframing that we have to do. It's this narrative shift that we have to do about what is going to really drive our healing. And you heard it a little bit from Dr. Smith. You heard it from Kassandra. I mean, we cannot just sort of sit into this, like, really this European medical system and think that we're going to get well. Like, we need to go back and sort of understand all the policies that have really been, I mean, from the Flexner report that really drove out our traditional medical practices and really drove out of our own freedom health institutions. I mean, these are policies that we know about, and now we're sort of continuing to see the impacts of it, about how our hospitals, how our systems have not been able to be maintained. And so having individuals, people of color, Black folks, BIPOC folks in leadership, we can help push. But certainly, this is a systematic issue. These are structural issues. And so we're not looking to put everything on someone's shoulder. We're not looking for Councilwoman Ampry Samuels to lead us to the promised land. This has to be a collective, organized structure. And leadership have to be willing to come to the table and understand that they have one vote, right? And in our humility, in whatever position that we hold, we have to be able to say that I'm coming here and offering up my talents and my skills for our own advancement, not to push an agenda. And I think that that's so important, being a part of this process.
Thank you. I want to come back to you, Dr. Smith, but before I do, because I want you to talk to us about what's on the other side of shame. But Dr. LaVeist, like, what, as someone who is from Brownsville, and been at Johns Hopkins and now at Tulane, George Washington University, so we start talking into the solutions piece. What are some way forwards, given the view from your perspective? Because you're outside of us now, right? So what are some ways forward?
Yeah, I spent a lot of time with policymakers on this very question of how do we move forward. I think that what Kassandra was saying is an important answer to that question. But I want to expand on what she said a little bit, that there are 4 disparities, not one disparity. It's not just that we're going to fix the health disparities issue. We're not going to fix the health disparities issue unless we deal with all 4 of what I call the 4 great gaps. There's health disparities, there's wealth disparities, there's educational disparities, and there's disparities in criminal justice. And by that, I'm talking about mass incarceration and over-aggressive policing. The other disparities beyond those 4 stem from those 4 disparities. And they all cause each other. They're caused by each other. And we're not going to solve. It's just as tonight we have this group of people and we're on here having a conversation, and the conversation is oriented around health. We're not going to make progress in health until we make progress across all 4 disparities, because they all cause each other. So we need to be, those of us who are on the health side need to be in dialogue with people who are working on criminal justice issues, working on wealth issues, working on educational issues, because the health issue is causing their disparity, and their disparity is causing our disparity. And so I think the way forward is that we need to get out of the sectors and not allow this is a very European concept, right? That knowledge can be compartmentalized into categories. So this is biology, and this is psychology, and this is botany, and this is not botany. And the fact is, knowledge does not conform to departments that universities create. Knowledge cuts across all of that. And if we're going to solve any important problem, it's not going to be resolved by people who are coming from one perspective and who are trained into one way of looking at the world. So physicians are not going to solve the health disparities problem, because so much of the problem has nothing at all to do with healthcare or medicine. Likewise, people in public health are not going to resolve the problem by itself, because a lot of what's producing the problem is not about public health. It's about economics. It's about education. It's about police. It's about all of these issues. So I think that's the way forward. The way forward is that we need to create an equitable society, and that is only going to happen if we get out of our lane of just focusing on the health sector and realize that this is a larger societal issue that moves beyond just the work that we do within health and healthcare.
sorry, Erasmus, I'll ask Dr. Smith a question, and then we'll see if we have any questions from the audience. So you mentioned shame, and when you did that, right? This history that we have with shame made me think about Dr. DeGroo's work around post-traumatic slave disorder, right? And we know that trauma is happening as a result of COVID-19, and from May, when we witnessed the very public execution of George Floyd, right? The trauma, the rage, the frustration, the grief, the loss, the mourning, all of it that happened as a result of seeing the continued brutalization and destruction of Black bodies via screens. What is a way forward if we're thinking about how we need to take care of ourselves, take care of our mental health? As you said, the two are entwined. So what is the way forward if we also focus on our mental health?
You know, listen to Kassandra and Dr. Torian, and they talked about everything being inclusive, and nobody understands how important mental health is. Mental health is so important, right from our little guys, the little kids. You know, if we can strengthen our children to believe in themselves, you know, and that's how you avoid shame, to believe in themselves and believe that they have some power. There's a lot of these disparities that we collectively can fight, you know, but there's so many of us they're filled with shame, and that's why it's so easy for us to go on drugs, because, you know, there's so much doubt, and we don't take that second step to say, well, I better not, you know. But I believe that if we change our approach to raising our children without shame and making them much stronger characters, you know, a lot of these disparities we can deal with better. And I think we'll be into stronger people. But right now, many of us are everywhere but our community.
Yeah, I mean, to your point, it's you know, it's hard to be in. I'm thinking about my experience trying to navigate my own emotional truth through what was happening in the pandemics, and also support my children, right? And look after my mom in her 70s, right? So like all of these things happening at one time.
And so many people like you and mothers who have to take care of both, you know, there's a lot of guilt going on. You know, am I doing the right thing? How, you know, I need to spend more time with my children so they can do this, you know, remote learning and so on. There's a lot going on.
And the frustration with that, because there are a lot of parents who are experiencing frustration with having to support their children during remote learning. And I'm also thinking about like bringing in the historical aspects of like the ways that Black people needed, the things that Black people needed to do and say in order to survive during the period of enslavement, post-Reconstruction, during Jim Crow, during Civil War, right? And how some of those practices that kept us safe then
we're still doing it.
Right, may not.
And you know, this is why shame is so prevalent, because this is how mothers protected their children. By shaming them, they wouldn't go out and do stuff that might put them in danger. It was so easy, you know. Moms, especially their boys, you know, control them, tell them they can't do X, Y, Z, you know, shame them, and they stay home. But there's a larger issue here, because once they go out, and they grow up in the world, that shame continues. Can I do it? I don't think I can. I'm not good enough. I'm far not good enough.
Certainly, like the shame and fear of raising Black boys, right?
And I get a billion people in my office, with all these degrees, and there's still that shame, and there's still that doubt about, can they do it?
I mean, it's certainly something that, that I deal with on a regular basis. And, when I think about having to assert myself, similar to what Councilmember Ampry said, assert myself whenever I say I'm from Brownsville and what that means to folks. You don't sound like you're from Brownsville. You don't look like you're from Brownsville. How did you
what
make
does that look like?
Right, exactly. But those are the things that we have to contend with on a regular basis. And, even some would say, define it as, oh, Erasmus, you've made it, right? But I'm always
like them.
Right. But I'm always going to be from Brownsville, right? That doesn't leave me. And I'm here doing this work. And so thinking about, the recent media coverage, the New York One media coverage, I don't know if all of you saw that segment, and how it sensationalizes, violence and gang activity in our community, and the impact that has on not only us as adults, but on the next generation of children that are watching that, right? And, the fact that they're carrying this scarlet letter, right, which is how I felt growing up. And the scarlet letter is B from Brownsville, and what that means, and that shame that we have to work a lifetime to get rid of ourselves. So I hear you, Dr. Smith. So thank you for sharing that. I know that there are a few questions that have come up on Facebook, so I want to turn it over very quickly to Anita. Anita, if you can share those questions with the panelists, that would be terrific.
So good evening. Thank you for a very thoughtful panel discussion. Just one quick question that actually came from the audience, and this will probably be open to I'll just put it out there for the audience. What are some of the local community resources that are available to residents of Ocean Hill, Brownsville for mental health services and also other services? So I'll open that up to whoever wants to take that.
Well, I'm not in Brownsville, so it's very hard for me to say. But now, today, everything is done on Zoom, so it's much easier to find someone to help you. Whether you be, working with children or adults, because right now you can't go in anybody's office. I mean, there are clinics. Don't get me wrong, there are clinics, but there are very few of them.
Yeah, I would just really quickly just give a shout out to Brownsville Multi-Service Family Health and Center, Family Health Wellness Center, because I know that they're offering services. Of course, they take health insurance, but you also can walk in, and I'm sure they have a sliding scale as well. I think the other resources, not necessarily local, but through the health department, we do offer NYC Well, which allows individuals to call 1-866 NYC Well to connect with a counselor.
Online.
Yep, and it is also online. You can also text, and you can have those services available to you. And I can also put it in the chat. So again, that's not necessarily local, but what we also do is that you can ask for a person based on their race and ethnicity. If you feel more comfortable with having someone of color to speak to, you can ask for
years to change that. I insisted when I first started that they put down that I was African American, and they wouldn't. And I said, then I won't sign up with you as far as your insurance. And they needed Black back then. Then finally they did. It took me years. They couldn't see the importance of people seeing people just like them. Each other, you know.
Let me just add to Anita that we've been seeing a lot of individuals, family members in the street that are having, different episodes, mental health episodes that have required a need to call for mobile services. And so, I want to be able to let folks know that if they see someone experiencing, an episode where they need someone to come out right away, we are seeing that. And, clearly during this pandemic, we've seen more of it. And they can also call that NYC Well and be able to connect with trauma teams as well.
So I have one more question that is from our online community. So this is a question about the process of when dealing with a mental health, an individual who is visually showing mental health issues on the street. So their question is, how would I'm trying to read this appropriately, so bear with me. Would you call EMS immediately, or is there like a system that is currently set up within our community that they would call if they see someone, as you mentioned, out on the street? That's what they're asking. Do you call 911? Is it 311 or 911 that you call? That's pretty much the focus of the question. Or is it, and especially as we're in COVID?
And I'm not sure of that, but I would call both, Sometimes, you have to assess it. Are they out there just, being stupid, and they're not hurting anyone, leave them alone. Because, I have plenty of people in here at home who behave like that, and they're not going to hurt anyone. But if you see somebody who's dangerous, has a knife or whatever, a gun or a thing, sure, you have to call. But you really should be careful. Everybody doesn't belong in the system.
Yeah, I mean, I think, one of the reasons why the question is coming up, and it certainly has come up for me, right, when thinking about, what happened recently with, the family up in Rochester, right? And so thinking about, having called 911 and then what happened his name is Danielle?
Yeah, that's a difficult call.
Well, but that's my point. My point is that there's a sense of fear, I think, in communities of color to call 911 because of what happened. And so I think that, it serves as a call to action for all of us to think about what are the systems that we can put in place so that we can help support individuals who are currently in pain and experiencing episodes on the street that will not lead to further harm by getting the police involved, right? And so these are conversations that, we're engaging as part of the coalition, and we're looking to engage the health practitioners, but also our elected officials in actually creating a mechanism to help support those folks. And with that, I'll just quickly pause and turn it over to Selena Trowell. She has a few questions that have come in from the audience as well. Selena?
Yes, hi, good evening, everybody. This is Selena. So I just wanted to shout out, there were actually some responses to the questions in terms of local resources that people can look forward to. And they may not be hyper-local, but it's something to also take note of. And we'll make sure to include these responses in the follow-up demo so people get if you have officially registered for the event. And so when Dr. Torian, he did put in the New York City Well, he dropped in the link for that. That is New York City. NewYorkCityWell.cityoFNewYork.us. Also, We Run a Brownsville, which is a local organization ran by one of our very own, Dion Graham, that's on the panel tonight. We Run Brownsville is currently providing free access to mental health therapists. So if you are interested in that, you can please shoot an email to info@werunbrownsville.org. Again, that's for if you have any questions or if you're interested in free access to mental health services. They're currently running a clinic, a free clinic, and that is info@werunbrownsville.org. Next, there is also somebody from the Borough President's Office also offered information about the ICL Institute for Community Living, which does service the Ocean Hill Brownsville neighborhood. And I'll make sure to also repopulate and drop these in the chat for folks that have access to the chat. That number is 88425-0501, and they provide counseling and mental health services. And before I go to what I do see is a question here from somebody in the audience, I just wanted to really acknowledge what Dr. Smith shared and also Erasmus, what you both shared. As somebody who does operate in the field of social work as well, we have to be super careful about how we address calling 911, right? And really, to your point, Erasmus, how do we begin to respond or create the systems in which it's not a carceral response to things like this? To your point with COVID-19, right, there has been a more prevalent issue of COVID-related psychosis. And so we think of moments and opportunities where our community is starting to see things like what, the 73rd Precinct had this sensationalized video of violence that happens in our community. But when we start to look at the numbers of increased mental health crises or psychosis or paranoia, and then for increase into partner violence or communal violence, we have to start to figure out what is our mechanism, or is there a flow in which when people are having occurrences or, engagements with police and or mental health specialists, are we questioning whether or not they've been tested for COVID-19 or have the antibodies, right? And so that's a real thing that we need to start to get ahead of the game now if we really have our community's best interests in mind. So I just wanted to share that. The next question we have is from Abigail. She shares that she's volunteering with the East Brooklyn Mutual Aid and that they are currently helping to address the immediate food security here in the food security crisis in Brownsville, East New York. And they're always looking for new volunteers. Is there a way to promote this effort? And so I say to you, Abigail, and for those that are listening, there goes your plug, all right? So I'm going to shout it out again, and I'll make sure that, and Abigail, I have your information, so I'll make sure that we also include that in our resource list. So we have a need for volunteers at the East Brooklyn Mutual Aid, and they service the Brownsville East New York community, and they're working to ensure that families that are in need of food have access to food. They are servicing and trying to mitigate the food crisis here, food security crisis here in our neighborhood. So thank you for that, Abigail. Thanks.
Thank you. So we just have still a few minutes left, and I want to go back to, I want to hear, Torian, more about the role that you have, the position that was created just for you, and just thinking for everyone, we heard the late, great Jocko and Councilwoman Ampry Samuels talk about like hope lives inside. What is going to give us hope? So I know we got next Tuesday coming, and certainly I think a lot of us have, some hope around next Tuesday, but like what gives us hope? And I'm gonna start with you, Torian, in this role that was created just for you. What's gonna give us hope?
You're serious about that, creative for me.
I'm dead serious. My mother's listening. I almost cussed. I'm dead serious about that.
I appreciate it. So just to talk about the position really quick, because I don't want to take too much of the time. Just recognizing where we are in this moment. I think that that's the important part of we know sort of the moment that we're in. The pandemics, plural, that we continue to push against, and there are certainly powerful forces, and I think that we need to be concerted in our effort. And so, as an agency, what we've been talking about is meeting this moment where it is, and certainly thinking about how we're preventing resurgence of COVID-19, but also anchoring and operationalizing an anti-racist framework for this agency, for what we want to see in the future of public health. And Dr. LaVeist had hit the nail on the head that, certainly the traditional public health model has been one that we understand sort of that has been the way that the agency has prioritized its work. But certainly going into this next administration and going into the future, we're going to have to really think about the priorities for this agency and sort of being relatable and responsive to the needs of the community. and that certainly will have to broaden our approach to sort of think about what are we really doing to not only address direct services and making sure that people can connect to sort of those health services, but also sort of thinking about how we are uprooting the policies that we know perpetuate and continue to cause inequities, but certainly what are we replacing it with? And so thinking about our agenda around environmental racism and environmental justice, but also thinking about the work that we can do and really forming collaborations with other governmental agencies and thinking about housing approach and really thinking about a long-term economic recovery plan. And I'll just end on this note that we've been thinking also about sort of shifting our work to sort of really connect more with other agencies, because we do not get to a recovery plan. We do not get to a true reopening of this city unless we think about our vaccine distribution plan. And certainly, we can just talk about, making sure that individuals get vaccinated, but it has to be an honest and truthful conversation about the skepticism and medical distrust that our communities have, right? And so if we don't do this collectively, if we don't even think about, what the impact is going to be, how people are going to push back, the distrust in sort of federal government, state, city, we don't get to even an economic recovery. We can't even talk about our barbershops and our businesses really reopening. And so, we really have to see this as a connected process. And so that's certainly, sort of been part of my work now in this new role, and sort of moving forward, sort of the future of the agency.
Thank you. So I'm going to go to Dr. Smith next. I'm going to leave the Brownsvillians for last. Dr. Smith, what's going to bring us hope in this moment that we're in?
Well, what's going to bring us hope? I've been thinking about this for a while. Just watching the marches and Floyd and so on, and we have a lot of young people out there, much more than we ever had, who are highly intelligent, who are determined, who have great backgrounds. I mean, that's our hope. White America don't realize how many young blacks out there that really have it together, that really can make change. And I think, young people are going to bring us hope.
Thank you. Kassandra.
I think the things that are important and are giving me hope is that so many people in my generation are taking mental health seriously and are truly investing in it. And I don't think you can have kids without shame if their parents are beaten down because you're just passing it off. And so I think it's giving me hope that people are really taking their mental health into consideration. And then I would say the other thing that's giving me hope is the young people that are running for office and that are taking up leadership roles. I do believe in the usefulness and the importance of Black leaders, but we don't need Black leaders if they're going to be gatekeepers. And so I'm really excited to see so many young people who are unwilling to bend to what the status quo says and are willing to really ask the hard questions and stand willing to create a different relationship around co-governance as opposed to governance.
Thank you. Dr. LaVeist. And then Councilwoman Sam.
So I have two quick answers to that. First is that what gives me hope is that we are literally the direct genetic descendants of the people that survived the Middle Passage, slavery, and Jim Crow segregation. That is the stuff that we literally are made of. That is what our existence is about. And so we're coming from people who have survived through a 4-century-long genocide attempt. So that means that we have within us the stuff necessary to overcome any challenge that can be put before us. That gives me hope. The other thing that gives me hope is that as I look at the number of African Americans who are moving into leadership roles in this country, I look at Councilwoman Ampry, for example, that the more of us that are going into positions where we get to allocate resources, where we get to determine where the resources are allocated. So we're moving from a culture that focused previously on speaking truth to power and venerating people that did that. But now more of us are moving to positions where we are the ones with the power and we're having people speak truth to us. And then therefore we get to make decisions about how resources are allocated. And more people that are moving into those types of roles are maintaining the sensibility that comes from the community that they were raised in, and they have not forgotten where they came from. And as I continue to meet leaders, African-American leaders all over this country with similar backgrounds to mine that are in positions where they're getting to make decisions about how things happen, and they're increasingly making decisions that are less likely to negatively impact our communities and more likely to bring resources to our communities. And that transition that I've been able to observe throughout my lifetime is something that gives me a lot of hope.
Councilwoman, you have the last word.
So, a lot of bad things happened during the pandemic. We lost a lot of loved ones. But when I say I've been energized and just hyped over the amount of just energy and people really being involved and just standing up saying, I'm not going to tolerate this, just checking people, is allowed me, I stand back sometimes and just say, yes, finally, we're getting there. And so, there's a lot of people doing amazing work. A lot of people focused on Brownsville, a lot of people coming back home, a lot of people interested in, trying to find ways to invest in our community. And so that keeps me hopeful. And, the negative stuff that we see is always like this small minority of folks. That's not the big picture. And so we're doing more about telling our story and changing that narrative. And so that just, that gives me the energy I need to keep going. And, I'm hype about it. And, people talk about, oh man, this country was about to, go down in flames. A little piece of me, I'm always trying to abolish something, right? A little piece of me was even hype about, we could be, going back to Black Wall Street. We could be going back to, the history of Weeksville. And so, I am hopeful and energized in the amount of activity that I'm seeing around the district and around the city. And I'm very hopeful that things are going to change for the better.
Thank you. Thank y'all. You got me hyped and hopeful now. Thank you all for this amazing conversation. Thank you to Erasma. And that's it for us, I think. We're going to turn it over to Janice, unless you want to say something, Erasma.
I just want to thank you all for participating and engaging in this conversation. I am incredibly grateful. I learned a lot and I heard a lot of things that I'm really excited about. Dr. LaVeist, when you talked about, the 4 gaps and how it's really going to take the effort of a collective effort is something that I strongly believe in. Dr. Smith, when you talk about, healing and the social relationships, that resonates with me tremendously. Council Member Samuel, when you talk about showing up as a collective, showing up as an individual, really tapping into our power. Kassandra, when you talked about, girl, just all of it. I learned so much just from hearing you. I felt your passion. I hear the importance of really approaching all of our people with dignity and pride and support. And I am just, and Dr. Easterling, I am so proud that you are on this team. I'm so proud that you have your eyes, your ears, your heart in Brownsville. And I look forward to collaborating with you in the future. And to everyone, this has been tremendous. And I am living in gratitude right now. So thank you very much.
Okay.
All right. So on behalf of the Ocean Hill Brownsville Equity Coalition members, I'd like to thank our esteemed hosts and guest panelists for joining us this evening to further this necessary conversation. And I also, just even, adding some additional thoughts just from hearing this conversation, I do want to, share with the guest panelists that we worked really hard as a group to figure out who should be the panelists to have this conversation with us and with the community, because this is such a sensitive topic that we really want to move the needle on. And so we are really grateful that you took the time to be here with us tonight, especially Dr. LaVeist, all the way from Louisiana. I didn't know if we were going to be able to pull it off, but you did it. So thank you for joining us from so far away. Acknowledging our collective trauma is critical to our individual journey toward healing. It is our hope that the town hall that we hosted in July and on today will continue to chart a path forward and inspire our community residents to take advantage of available resources for mental health and propel those that can offer additional resources to come forward. In order to ensure that our voices are heard loud and clear and our community leaders are walking lock and step with us, we ask that each and every one of you participate in the upcoming election by showing up to vote beginning on Saturday, October 24th through November 1st for early voting, or on November 3rd, which is the general election day. Many of you asked, how do you get a copy of this video? The conversation was so profound. And so I know many of us can't wait to listen to the playback so that we can write down all the important information that we heard today and begin to dig a little bit deeper. I myself was already posting about the tree walking, in the woods, and doing those breathings. I love nature. And so I can't wait to practice what I learned today. And so for those of you who would like to listen to this video and share it with family members who you know would in the conversation, it's going to be available on our Facebook page at OBH Equity and the letter C. So if you're not following us already, we ask that you follow us so that you can get additional updates about future events and also listen to the other conversations, because we are definitely being very intentional about connecting the dots between the conversations that we have. Additionally, the video will be available on rfwilkinconsultants.com. I think that would be beginning sometime next week. I think it was as early as Tuesday or definitely by Thursday. So thank you all for joining us. Yours in community and power. This is just the beginning of what we are doing together, and this is a continuation of what our elders have started and we have learned so much about along the way, and we will continue to learn about. So thank you, and we look forward to our next conversation with you all.
Thank you.